Welcome everyone, and we are trying out a new system, Zoom, for our Healthy Markets Community of Practice session. And thank you so much for all your cooperation so far. We are just trying to figure out what would give us the best experience as a community of practice. But I would like to take this moment to welcome all of you all to our this month's Healthy Markets Community of Practice session that is going to focus on Sierra Leone. Before I go on any further, Andrea, would you like to please give us our opening remarks?
Oh, yes. Thank you, Farhan, and good afternoon and good morning to everyone. Um, I am Senior Technical Advisor with USAID, the Office of Population and Reproductive Health, and always pleased as USAID is a co-sponsor of this community of practice along with UNFPA. And I am super excited about our country focus being Sierra Leone today, and really appreciative of all the speakers and all of the organization. I know there's a fantastic lineup. Some folks whom I've met personally, and I also want to give a warm welcome to my colleague in USAID Sierra Leone, Aya Soskane, who will make some remarks later in conclusion. But I want to say, I know because Farhan, there is such a great lineup of speakers that we will remind kindly all our speakers that don't take it personally. Farhan will be quite diligent with timekeeping and asking people to wrap up. I know as I looked at the slides, a lot of the slide decks were quite short, and thank you for that. Please will also encourage everyone to put lots of comments and questions in the chat, and that will allow Farhan to help with continuation and then any discussion at the end. And I know we're all very interested in hearing what all the partners are doing in country to improve access, ultimately to sexual and reproductive health and family planning information, products, and services. And there's a lot going on in Sierra Leone, and there's a lot of potential. So with that, Farhan, over to you, and perhaps Ben is going to make a few remarks. Thank you.
Thank you, Andrea. Yes, Ben, would you like to say hi to the group and give us some remarks?
Thank you. Thanks a lot. Can you hear me?
Yes, Ben, we can.
So really, just to echo everything that Andrea said, thanks to everybody for being here. And really, we don't have a lot of time, so I'm not going to say anything except that I'm here to learn. I'm very, very excited to hear what is going on in Sierra Leone. Without further ado, back to you, Farhan, please.
Okay, thank you so much, Ben. And so, yeah, everyone, as mentioned previously, we have a very interesting lineup of about 10 speakers, which I think is one of the most we've had for our community of practice sessions. So looking forward to that. But yes, we'll have to be quite short on and, snappy as far as time is concerned. So to start us off, I'd like to invite Shankar to present a market description for Sierra Leone on behalf of FHM Engage. Welcome, Shankar.
Hi, can you hear me now?
Yes, Shankar,
Yes.
we can. Please go ahead.
Thank you. So I have a low bandwidth issue and I'm not going to come on video, but lovely being here. To kickstart this process, could you go into the next slide? So to set the context, we thank FHM Engage's core partner, Pathfinder, with whom we worked, and with local organizations, PARHA and Corona Management Systems, to lay out the market description for family planning products, services, and information. Sierra Leone, as many of you know, has a population of 8.6 million, predominantly young, And of the young population, 60% are youth. It's also important to highlight that 60% of them are unemployed. Over the last three DHS, while MCPR has gone up from 6.7 to 20.9, Sierra Leone has an ambitious target to achieve by FP 2030 of 32. We just quickly wanted to call out that Sierra Leone contends with high rates of child marriage and teenage pregnancy. Next slide, please. We did break down the use need analysis with DHS 2019. One of the callouts is that among married women, which is of the 2.3 million population of WRA, married women are 1.4 million. 35% use modern methods and 65% do not use modern methods. Also very interesting for Sierra Leone, Sierra Leone has got the fastest growing proportion of unmarried women using contraception amongst sub-Saharan Africa. Next slide. We did go down into very specific segmentation of adolescents between the ages of 15 to 24, who account for nearly a third of the overall use need gap. I think it's becoming obvious that supporting unmarried adolescents between the ages of 15 and 19 as they get older and get married can help to close the use need gap. Unmarried women in Sierra Leone account for around 11% of all WRAs. The other thing it's important to mention as we did the analysis for use need was the high discontinuation rate even amongst 15 to 24. 35% or 1 in 3 women of reproductive age discontinue modern methods. Next slide. Overall, there's a low density of health workforce. When we come to private sector, it's even less. Private sector facilities are mostly concentrated in capital city of Freetown. Around 12.1% went to pharmacies, which essentially are concentrated around urban centers, but also act as last mile solution providers in rural places across Sierra Leone. Next slide. One of the things that we learned was the declining use of private sector over time. While we need to understand this phenomenon a little better, we did an analysis of the sales trends across both sales for social marketing as well as commercial import data. While the overall declining use of private sector is highlighted by DHS till 2019, I think it's important to highlight the fact that between 2020 and 2022, we do see increasing sales trends for SMOs and commercial sector, specifically for injectables, oral contraceptive pills, and emergency contraceptive. Next slide. Women ages 20 to 24 access the private sector for contraceptive methods most frequently. As a source of contraception, private sector is more popular in urban areas and across the two highest wealth quintiles. It's interesting also to understand that while private sector is preferred overall for condoms and pills, we see that 1 in 10 women also access pharmacies and private sector specifically for injectables. Next slide. One of the things we did want to call out was we do see a greater level of political commitment and better stewardship through the Ministry of Health and Sanitation. They have a national strategy for enabling policies both for teenage pregnancies. But going back to the lower density of health workforce specifically, two callouts are service providers are limited in number and their scope of work is further hindered by restrictions. Illustratively, community health workers are limited in the family planning methods that they can offer, and currently they can only provide condoms and refills of contraceptive pills. There are no specific affirmative laws for adolescents to access services without consent. And this is a lack of signal for both clients, young users, as well as providers who provide family planning services and products, because there's a complete lack of signal with absence of affirmative policies. So though there's a visible commitment for stewardship by MOHs, I think we would want to see better signals for both clients and private providers, specifically for provision of family planning methods for adolescents and young people. Next slide. We did come out with a recommendation for execution by our local implementing partners, and you'll be hearing more of this from PARHA and CMS later in the presentation. These were the top strategies and recommendations that we had based on the market description. You can find the more comprehensive market description in the healthy market links. So adolescents and youth SRHR is the strategic priority. And so at least in the core functions, how do you align supply and demand side addressing demand side barriers for meeting the aspirations of adolescent and youth? Specifically, also improving financing support for private sector in family planning. It's important to mention that in Sierra Leone, 90% of commodity requirements are taken care by UNFPA contributions. We also realized that there was increased need for strengthening stewardship for adolescent and youth and private sector engagement. And one critical component was work with local implementing partners to improve market intelligence that would allow private sector investments and participation. Thank you.
All right. Thank you very much, Farah. Shankar, I'm sorry. I am stepping in just for a moment at least because it seems that Farhan got dropped from Zoom. So, and I know, Shankar, that what you shared was just very much the tip of the iceberg in terms of how we can describe the family planning market. So a lot more to come on that. And next up, we have Gladys Goba from Planned Parenthood Association of Sierra Leone. Gladys, over to you. And Gladys, if you are speaking, we're not hearing you yet, so let me know. And I'm not sure if Gladys might have gotten dropped because I'm not seeing her in the list right now. So Gladys, please feel free to message us, but in the meantime, Phildis from DKT, let's go on to you and we'll come back to Gladys as possible. And clearly this is the challenge of changing technology. So, but we are nothing if not resilient. So Phildis, are you online and can you start to talk now and tell us all about DKT?
Yes. Hello, everyone. Thank you, Andrea.
Welcome. So great to hear you. Thank you.
You're welcome. Can we move to the next slide, please? Next slide. Next slide, please. We are a non-profit organization.
Yeah, go ahead, Phildis. We can hear you just fine, and we can see the who we are slide. So hopefully that's good for you. Over to you.
Okay. We are a non-profit organization and we promote access to innovative, safe, and affordable reproductive health products and services through social marketing. DKT was established in Sierra Leone in 2018, and so far we have achieved tremendous health impact in terms of capacity building and providing cost-effective contraceptive and safe abortion products. Our work mostly is with the private sector, but we also support the public sector by partnering with the government health facilities. Next slide, please.
Yep, and we can see the next slide.
Our mission is to create what I wanted, and our mission is to provide couples with affordable and safe options for family planning and safe abortion products through dynamic social marketing. Next slide, please. Now to what we do. This comes in terms of market access, expansion, and reaching the last mile. This is grouped into three, which are the social marketing, demand generation, and capacity building. So let's start with social marketing. We are a social marketing enterprise, and our products are cost effective. And we also ensure that our products are accessible across the country through various sales channels, such as our sales managers, our sales distributors, our sales agents, and our wholesalers. And so far, we've distributed to over 2,000 pharmacies, drugstores, and non-traditional outlets across the country. And we have physical presence in all the major districts in Sierra Leone. The second part talks about our demand generation aspect, in which we engage in activations. Our activation is our mobile outreach program, in which we provide free family planning commodities and services to slums and hard-to-reach communities across the country. And so far, we have rendered this service to over 30,000 Sierra Leoneans. We also have our leader community representatives. They are trained to engage people in communities about family planning options, and they then refer them to nearby pharmacies or clinics to get these commodities. Our leader campus clubs engage in university students on sexual reproductive health services and make it easily accessible to these students. So we also partner with pharmacies that are closer to these universities so they can get access to these products whenever they need them. Next slide, please. Our capacity building. Through our trainings, in which we are collaborating with the Ministry of Health, the Reproductive Health Department, we've trained over 1,000 service providers on post-abortion care services and long-acting reversible contraceptives. We also engage the pharmacies and drugstore attendants on our family planning, products, HIV self-testing, pharmacovigilance, and proper counseling techniques. Next slide. And you can see data of how many people we've trained so far since DKT started in Sierra Leone. This slide shows our products that are available in the market. We have two brands of condoms, the Kiss and the Fiesta, and we also have our Fiesta lubricant. Our emergency contraceptive is called the Lydia Post Pill. Also, our daily oral pill is called the Lydia OCP. We also have our intrauterine devices. Our Lydia Fem3 is our combined injectable, 3-month combined injectable. We also have the misoprostol tablet and the MMCombi tablet, and our manual vacuum aspirator. They are also available in the market. Next slide, please. This is just pictures from trainings that we've done on post-abortion care and the LAC trainings, and also the pharmacy attendant trainings that we also carry out. The next slide. We also engage in private sector collaborations and engagements. We have some collaborations with hospitals and clinics through our Lydia partner clinics. So as part of our own way of strengthening the delivery of family planning in the private sector, DKT doesn't run a franchise clinic. We work with existing private clinics and we provide the necessary support for them to set up and run family planning as a paid service. We also have our Lydia partner pharmacies, in which we have a partnership with some pharmacies, drugstores, and non-traditional outlets to render family planning services and counseling to consumers. So if someone walks into any of our leader partner pharmacies. They can get good counseling on any family planning methods they choose. Next slide. Our future collaborations. These are projects we intend to implement and some also to scale up. One of them is youth-targeted family planning activations in slums and student communities to reduce teenage pregnancy, also partnership with digital platforms to reach young people both online and offline. And also we plan on working with influencers on social media platforms to generate awareness on family planning options that are available in Sierra Leone. Next slide. Thank you very much. Thank you.
Okay, thank you so much for that, Phildis, and always quite interesting to see the work that DKT is doing. Now, I know we are still trying to get Gladys to speak, and I see we have just managed to do that. So Gladys, can we please go to your presentation from the Planned Parenthood of Sierra Leone?
Yes, hello. Gladys is here now. We are having some technical problem.
No worries, Samuel. We understand. Please, Gladys, go ahead.
Yeah, good afternoon, everybody. Good day. I'm Gladys, and PPASL is one of the service providers of family planning products and also advocating for young people and youth rights to get the SRH services. And our vision is a Sierra Leonean in which women, men, young people have access to information, affordable SRH services they needed in a country in which sexuality is recognized as a natural and fundamental human right, where choices are fully respected, devoid of stigma and discrimination. And our mission has always been that we're leading national, non-governmental, non-political, non-profit, volunteer-based SRH-focused organization. We strive to improve the lives, the quality of life of the poor and vulnerable women, men, and young people in especially hard to reach and underserved communities. Next slide. We are committed to achieving excellence in meeting the sexual needs of the poor and vulnerable individuals and families by continuously improvement in our programs, processes, and service through research, advocacy, capacity building, networking, and service provision. We currently operate in 8 districts out of the 16 districts in Sierra Leone. That's Western, Urban, Rural, Bo, Kenema, Kaila, Umputloko, Bombali, and Koinadugu districts. We complement and coordinate with existing national programs in support of national policies, priorities, strategies, and partnership. We are currently implementing projects supported by IPPF, our parents' body, Save the Children, and UNFPA over the years in our operational areas. Next slide. Our key intervention is 1, service delivery, 2, demand creation and awareness raising. Let me start with service delivery. On service delivery, we do integrated mobile outreach clinics. We do outreaches in different communities around these 8 districts that we are currently operating in. And we have static clinics in all of these clinics. In all of these districts, we have our youth clinics and also our SRH clinics. And we also have community-based service providers that do door-to-door sensitizations whenever they go around their communities, and they provide the short-term methods of contraceptives, which is the male and female condoms, and also the pills, which is microganon and microlute. And so we mainly do outreaches and also provide services in our static clinics. And we do engagements with university students and over the years. doing short videos, doing documentary, and also doing live health talks to their contemporaries. And they have been attracting over 4,000 views monthly in their different platforms. We've signed MOU with vulnerable groups, especially people living with disability, and they've been supported and to promote and they've been supported with the provision of shorter methods in which they do distribute those contraceptives to their constituents. The MA we are currently in the implementing the social enterprise, which is a new phenomenon for us. We started by equipping our service delivery points, especially our model SRH clinic, which is at Midtown, and we have a pharmacy and a laboratory and also a maternity clinic where we do surgeries, and also we do antenatal care and other SRH. We provide other SRH services. And we've extended our partnership to also the private sector. Like example, the pharmacies, we've signed MOU with some pharmacies, and we are currently distributing some contraceptives so that they will get more people to be able to access the contraceptives from these pharmacies, and they normally do report to us. We are also in contact with other groups, especially the CBOs and female-led groups that do to our facilities and to take contraceptive and also for their constituents. And the MA is also leveraging resources for capacity building and technology and for sustainability. And we have contributed, because of these interventions, we have contributed to the current 20% of the family planning uptake in our country. Next slide. Yes, we are hugely participating and supporting the advocacy, because that's one of our key interventions. We have been very, very, very effective in championing a series of policies, like, for example, the CALS policies, which is the Child Adolescence Health Services, and also the FP financing, because initially there was this commitment from government for the contribution for the government to increase the budget allocation from 11% to 15%, and PPSL has been very active in that. We also have been very active in getting the Safe Motherhood and Reproductive Health Bill to be enacted, which is currently at cabinet level. And we also, under CAL, we are very active also in getting the CSE curriculum we want it to be a standalone subject in the curriculum. Currently, it is being embedded in about 7 different subjects. We've supported to partners to contribute immensely to influence the Safe Motherhood Bill, and we've worked with PARHA, because currently we are the vice chair. We sit at and to be very active that next slide. Thank you. When we go on our outreaches, we do provide free FP services to young people and youth, because that's the key of our service delivery. Thank you.
Thank you so much for that, Gladys. And I mean, we all know the important role that advocacy plays. And thank you for all that you do. And I think for me, what's very interesting is to see the focus as far as youth are concerned in Sierra Leone. I think already that's something that we are seeing come up quite a bit in the different discussions. And I think it's also a good segue to the next presentation from PARHA, who are also very kind to assist us in organization of this time's community of practice. So Fodi, I believe you have been enabled to present.
Hello, good morning from my end.
Hey Fodi, we hear you.
Okay, of course, I'm Fodi Paul O'Neill Kamara. I'm Chairman and Executive Director of the People's Alliance for Reproductive Health Advocacy, PARHA. Let's go. Of course, let's go to the next slide, please. Of course, my presentation outline, introducing PARHA, who we are, our vision, mission, our core values. Then the next is the work we do, our strategies, and our key success areas. Let's go. Of course, we actually established PARHA in early 2017, and we established this coalition with initially about 30 organizations and individuals working around sexual reproductive health and rights, but now we have increased our constituents to about 72. And we established PARHA to influence law reform around sexual and reproductive health rights. I mean, that is the policy, the legislation, strategies, plans, and so on in Sierra Leone. The rationale for actually establishing PARHA was that when we looked at the data on the maternal health, data on teenage pregnancy, data on sexual and gender-based violence, we saw that they were really appalling, and we needed to step in to ensure that at least we collaborate with government and other development partners so that we can contribute to reduction in those things. And also we wanted to be part of the process of improving on or strengthening our health system. So we have a vision wherein we want to see that we have a strong health system, and we have adequate and qualified and competent human resources that is capable of delivering, sexual and reproductive health and rights services to all Sierra Leoneans. And we want to contribute as a mission. We want to contribute towards, raising the level and quality of reproductive health services and standards of living of all persons within Sierra Leone. Of course, for our core values, we are committed to upholding transparency, integrity, and accountability in all respect for human rights and dignity. We are focused on teamwork because we can't stand alone, and that's the reason for which we are collaborating. Let's go to the next slide. Of course, our strategies fall within 5 broad areas. First of all, we conduct research. We undertake research to really determine the impact of service delivery, the impact of policies and legislations, guidelines around sexual and reproductive health and rights on our population. And we also use the research evidence to provide our necessary support to those we are working with and those we are working for. And we also work through advocacy, and currently we are the leading civil society entity on the Safe Motherhood and Reproductive Health legislation that PPAS just mentioned. And we also help in conducting trainings. We have been conducting trainings on VCAT for project proposal writer, M&E, fundamentals, etc. for our membership, as well as for like Marie Stopes, we have done a lot of VCAT sessions for them, for their staff, especially the frontline staff, the nurses, on around the abortion stigma, and like other institutions like the Interreligious Council of Sierra Leone. And we work through collaborative partnership, and we have signed an MOU with the Interreligious Council, and established a joint advocacy working group. And that's the reason for which it's smooth with the route towards trying to enact the Safe Motherhood and Reproductive Health Bill has been smooth somehow. And we also signed a partnership agreement with the parliamentary unit, a parliamentary research unit, wherein we are part of their process of providing evidence to parliamentarians, for them to be able to actually debate in parliament. And we also have been part of their think tank, so that at least we conduct trainings, for them. And we also do empowerment and, participatory. I mean, we ensure that the women, and the youth that we work with, we empower them through trainings with, and other things. So let's go. Next slide, please. Okay, our key success areas. Like I said earlier, we are leading on the Safe Motherhood and Reproductive Health legislation. We've been collaborating with the Ministry of Health and Sanitation on this, and we did some work with the Interreligious Council. So we are part of the technical working group and part of the steering committee. And we are co-chairing the technical working group with the Directorate of Policy, Planning and Information on the Safe Motherhood and Reproductive Health deal. And of course, the second one, we also signed a partnership agreement with the PRU of the Parliament. And we collaborated with the Guidance and Counseling Unit of the Ministry of Basic and Senior Secondary Education. And we are part of the initial engagement on the comprehensive sexuality education. And through Marie Stopes, which are a partner, we actually supported the development of the CSE in Sierra Leone. And we have been technically supporting the Teenage Pregnancy Secretariat in their documentations and some of the engagements. And we have already also been working collaboratively with the African Population Health Research Center that are based in Nairobi. And they have, over the past 3 years or so now, they have conducted a lot of trainings for our youth who are in the sexual reproductive health and rights landscape on various topics. And we always lead on this. And we are part of the abortion incident survey they conducted, because we populated the over 3,000 respondents for that survey. And we have worked with various groups to demystify the myths and misconceptions around SRHR issues like abortion, contraception, with the media, with key media houses, with the Interreligious Council, traditional chiefs, especially the Council of Paramount Chiefs. And we are the lead consortium partner on the FHM Engage Stewardship for Youth-Driven Demand for Family Planning in Sierra Leone. That is funded by USAID through Chemonics and being supervised by Pathfinder. So what are we doing currently? The FHM Engage, the stewardship for youth-driven demand for FP in Sierra Leone, has two results areas. One is to improve market environment for greater private sector participation in the delivery of health products and services. And secondly, where the second result is to improve equal access to and uptake of high quality family planning contraceptions. And our key focus here is we want to increase access to family planning among youth in Sierra Leone. And what are we trying to do. One is we want to have a private sector-driven public-private engagement platform. We call it stewardship platform that we want to establish within the Ministry of Health and Sanitation. And by doing that, the private sector, especially like the commercials, will have access to the government documents, and they will have access to interfacing with the officials at the Ministry of Health and Sanitation on family planning commodities, discussions and decisions made on family planning commodities, especially in terms of like taxation, in terms of distribution, in terms of, reaching the last mile. And another area that's, is very much important is that we have established 2 thematic working groups in the private, public-private dialogue, so that at least we have youth-led thematic working group that we have established, and we have supply chain-led thematic working group. And this supply chain-led thematic working group is purely on family planning commodities. So we want to ensure that this is integrated into the larger health commodity logistics TWG within the Ministry of Health and Sanitation. And we also want to ensure that the youth-led TWG also is integrated into the general TWG, the wider TWG around sexual reproductive health issues within the Ministry of Health and Sanitation. And we have already developed...
if we can summarize, please.
Yeah, we have developed certain documents for the supply chain. We have developed a supply chain strengthening brief that we want to share with the ministry. And we also have developed an advocacy brief for youth that they can use to discuss and to advocate and lobby the government around sexual reproductive health and rights commodities, especially family planning commodities. Thank you.
Thank you, Fody. Okay, keeping it going because of time, can I please invite Dalton from Health Alert to take us through the next presentation, please?
So thank you very much, Far, and thank you very much, colleague. I hope I'm clear enough.
Yes, we are, Dalton. So
thanks very much to everybody, all contributors so far, presenters so far. Thanks very much. It has been exciting. First of all, I want to say a big thanks to FHM for giving us the opportunity and to share this platform and to be part of this community of practice. Next slide. So my name is Dalton John. I am the programs lead for Health Alert. And I will be presenting on the outline as stated here, doing a brief introduction of Health Alert. I know time is of the essence as it is right now. I know, Yusuf, you're watching your time and everything. So I want to make sure that I get straight to the point for which you asked us to present on. So my presentation will be basically focusing specifically on looking at family planning access and specifically looking at private partnership with regards to family planning as the case may be. Next slide. So I know this slide is a little bit busy, but I'll try my level best to make it very brief. So Health Alert is a civil society network organization, primarily work around health development advocacy. And we've been established in Sierra Leone since 2009. We are 13 years counting. And basically, we do caucus and around and build consensus around national and subnational family planning priorities. We also develop and adapt joint actions and framework. So we want to look at family planning policies and guide. Somebody mentioned the Teenage Secretariat Reduction Strategy, which we just validated. Also, knowledge exchange and capacity development. So as a civil society network organization, we have about 53 civil society organizations, including youth organizations across the 16 districts, wherein we come together, we converge and build knowledge around our intervention and how we work. So our vision, as it's stated here, we do promote the health and rights. We believe in the fundamental human rights, that health is a right for everybody, and everybody, irrespective of your class, your race, wherever you find yourself, you must have access to it. We talk and advocate around increase access to adolescent sexual reproductive health and family planning. We work a lot around teenage pregnancy, and also we foster intersectoral collaboration with responsive policies and investment. That will mean that at national level and even at subnational level, we do not only develop this policy, we do not articulate this policy only at national level, but we ensure that these documents are localized, institutionalized at the district level, where actually interventions needs to be happen, as we want to say, we call the last mile. Next slide, please. So for private sector, our private sector engagement through PI. So for Health Alert, we are what we call the lead convener for the Global Financing Facility here in Sierra Leone. And as such, we've been working with the GFF through the World Bank, and we've been implementing activities that are looking at commodity security specifically, and looking at how health service delivery are conducted as last mile. And so we're very much articulating and engaging at that level. Through this project, we've been able to interface with what we call now the Private Partnership Secretariat, which is housed under the Directorate for Planning and Information at the Ministry of Health, wherein we are engaging with private sectors like companies, pharmaceutical companies, to discuss with them and to get them into mainstream, because this has been a challenge. This has been a challenge over the years, even in the multi-stakeholder platform that is set up here to look at reproductive maternal and child health through the GFF arm. We know that's a challenge, and bringing them on board is something that has been requested from higher quarters, even from World Bank perspective. And so for Health Alert, that is something that we're working on. And even at the subnational level, we continue to engage with private sector, private pharmacies, private hospitals, private outfits that are delivering services, family planning services, and other services to ensure that they come into the fore, and a way of saying that we need to know what are your challenges, we need to take them on board and to basically articulate them at national level, where we converge with stakeholders to ensure that we bring it to their attention, to ensure that we take the process forward. We also encourage private sector investment in family planning. As I was saying, we are in a deep conversation now with what we call the Private Health Federation, which is headed by Professor Wuri, the wife of Professor Wuri, and she's professor too. And we've held several discussions with them, and we've developed a memorandum of understanding to say how Health Alert will continue to bring them mainstream with government to ensure that the issue of commodity security is taken seriously, and to see what are their interests, what they do have in their hands to bring to the table when it comes to supporting the government with regards to investment in family planning, as the case may be. Next slide. So for tools and intervention around FP market development. So we are the pioneer for the FP 2030 commitment. As Health Alert, we are the civil society focal point for FP 2030 in Sierra Leone. And so we've been piloting what we call Emotion Tracker. This is a tool that was developed by Samasha, based in Uganda, as to how we follow up on our FP commitment. As you know, one of the strategies within the commitment itself is looking at supply, which is very, very critical. We know that supply is a challenge, and the family planning, commodity security is embedded within that particular strategy as itself. And we know that pushing it, making sure that we engage all those players, as I shared earlier on, to ensure that the commitment that are made, we know 90% of the investment in Sierra Leone with regards to family planning is coming from the private sector, chiefly the UNFPA, and we don't want this situation to continue. We want to look at sustainability punish forward. So that is why the very reason we are articulating and ensuring that as a civil society we lead lead the four, engage our peers to ensure that we continue to monitor those commitments going forward. Private sector and Health Federation I highlighted earlier on, we are in deep consultation with them. In fact, in our mapping matrix, they are very critical in the discussion around Sierra Leone commitment to family planning. We do know that we've developed a family planning costed implementation plan. How much of that plan has been implemented, how much the government has contributed to that plan is still a challenge. We continue to discuss those discussions as we proceed forward. Collaboration with Health Alert to build partnership and to integrate family planning service within the private sector health provider. This is something that we're working on because we do believe that to improve health outcome, to improve access, we cannot leave this very critical mass out of the equation, as I stated earlier on. Next slide. And so for some of our achievements, I just want to highlight quickly, we've been working with support from USAID MOMEMTUM, which has been a very big partner to Health Alert, giving us capacity to ensure that we engage at every level, even as we do have a strong caucus of adolescents and youth, which is dubbed now as the AY mechanism, which has also been trained equally for us in smart advocacy approach, in family planning data, in health security commodity. At every level, we engage at subnational level, councils to ensure that the area of domestic resource mobilization to support commodity security is being done to ensure that whatever mega resources they get from own source revenue is being put into the force so that they help support last mile, because we do know that sometimes commodities stay at the subnational level, at district level, and they do not make their way to last mile. And when you ask questions, you say because a vehicle is not available, there is fuel. And so as part of the private sector engagement, even the private sector drivers are on board in this to ensure that we continue to take those discussions forward. Improve accountability. We do, as Health Alert, as an organization, we're very strong and very big in social accountability. From time to time, we do have convening meetings where we bring all the stakeholders, be at national and subnational level, the district medical officers, the council chairman, the mayor, the council administrators, and all other players at that level to sit on the table with community stakeholders and clients together. We discuss the issues and where there are ways to solve them and whatever needs to be done to ensure that health service delivery is being done to the level wherein our clients are able to go to those facilities and access those communities, especially our young people, young adolescents and youth at those at last mile level, to ensure that those services are provided when and when they are requested and when they are attended at those facilities at last mile. And we've also had a lot of positive outcome over the years as we continue to engage. Now we have the opportunity of young people, engaging at that level with duty bearers, and we've had opportunity to have commitment from duty bearers saying that the 2024-2025 budget hearing has just concluded. We are pushing it, looking forward to the parliamentary reading, wherein we've had commitments from subnational level councils that they are saying that going forward, 2025, they're looking forward in their plans to ensure that some amount of funds is being made to ensure that they support health security, commodity, last mile distribution, and adolescents and youth activities around family planning, sexual reproductive health at that level. Next slide.
Dalton, if we can please quickly summarize.
I'm done. This is just a photo to actually articulate what I've just highlighted. All this engagement that we've had with the Ministry of Health on health commodity security, with councils here, with facility maintenance committee members at that local level to ensure that they are part of this process, and also with our council staff at every district that we've engaged. Over to you. Thanks very much.
Thank you so much for that, Dalton. Now, I have written in the chat, we are trying to figure out who the presenters from the Pharmaceutical Society of Sierra Leone and the Sierra Leone Midwives Association are. In the meanwhile, I would suggest that we move to UNFPA for their presentation. I know we have Gamachis here. Yes, Gamachis, please go ahead.
Yes, Farhan, thank you so much. I'd like to thank Frontier Health Markets Engage program and also the in-country PARHA, People's Alliance for RH Advocacy, for organizing this webinar. I just wanted to mention, just in case there is internet interruption, I would be joining through my phone. I'm now on my computer. And the data that I will be using in my presentation may be a bit older, from DHS 2019, DHS 2019, because we are going to have our next one in only 2025. So let's proceed. What I'm going to do here is just to give you a country context and some data on family planning context, and then on private sector to reinforce what has been maybe already presented at the beginning, and our work on FP investment case, which was launched this year in 2024, and finally UNFPA's contribution in short. So the country context, it's good to look into the total population. As of 2022, it's 8.6 million. And what we may want to note here is, as everyone may expect, Sierra Leone is a very youthful population, as you can see, under age of 25 and also under age of 15. The challenges here in the country has faced a number of shocks in the last 2-3 decades, including the civil war, the Ebola, and also the recent COVID, and also some economic shocks. But the country is still, the country has pulled through all these shocks. In terms of debt, also the country is struggling economically, and there is high donor dependence, especially also with some basic services like family planning. And what is very important to note is also the social and gender norms are the root causes for some of the issues we have in FP program. However, the commitment of the government is solid on social development, including reproductive health and family planning. There are also really encouraging progressive laws and policies. And we have seen in the last 2 decades or so very huge improvements, like for instance in maternal health, we have seen 74% reduction in maternal days in the last since the turn of the century. In education also, there are a record number of children being enrolled in school. And currently, we do have medium-term national development plan from 2024 to 2030. Let's go ahead. What we may want to note on family planning is there is still persistently high unmet need on family planning. For the last 2-3 DHS results, you can see the unmet need has really stayed high at 25%. The modern contraceptive prevalence, the contraceptive use has been increasing gradually, but lately we have also seen slowing progress. Just to see between 2012, since the FP 2020 until 2016, it used to grow by 1.2% every year. But since then, that rate has halved to 0.6 or so. The other thing to note is also the high disparity by age, districts and education. By age, we see especially among married adolescents, very high unmet need. And among those with no education, we also see very high unmet need. And there is also stark difference between districts. In some districts as high as 32%, for instance, in Kailahun, the contraceptive use, and in Falaba, like 7%. And but in terms of facilities offering choice of contraceptive methods, at least we have more than 90% of service delivery points offering at least 5 modern contraceptive methods. Continue, please. And in terms of demand, there is a still high number of women and girls who have not yet shown expressed need for family planning, very low demand from the last DHS. And our interventions are mostly inclined to the supply side. And the proportion of women and girls that do receive family planning message, especially among adolescents, it's also concerning. The demand side barriers, it's mostly related to breastfeeding. Just having reason of breastfeeding may deter women, mothers not to use family planning, and also the norms and beliefs are the main barriers to demanding family planning. Let's continue. And in terms of private sector, just to strengthen what my colleague might have already presented earlier, as you can see, private sector share of the market of FP users is around 18%. But it is much higher in Western area, urban, where Freetown is, and the Western area rural, as you can see here. And the private sector facilities, especially in the previous costed implementation plan for family planning, it was planned to contribute at least 3.3% to the contraceptive prevalence rate. And also in the current CIP, there is still, even though we are, the priorities are not that much around private sector, but still the contribution of private sector is something that the CIP touches upon. In terms of the issues here, we don't really have a strong contribution of data from the private sector. Data from this sector is not collected in the HMIS, the DHIS2 platform that we have. And the method choice in private facilities is also concerning, as reiterated earlier, very much inclined to short-acting methods, even very much limited to condoms and pills, but in some facilities, injectables may be provided. Policy issues are also there, for instance, on self-care in expanding the MPA subcutaneous, for instance, and also task sharing and shifting in terms of providing long-acting reversible methods.
Gamachis, can we summarize, please?
Good. All right. If you go ahead, I'm only left with two. This looks a bit packed, but I just wanted to mention family planning investment case we have launched this year for the remainder of years until 2030, which projects actually three scenarios: business as usual, achievable, and the ambitious one. And the funding gap analysis has been also analyzed, and opportunities for funding family planning services. But here the question is, how can the private sector contribute to filling this funding gap is the question that we have to underline. But family planning has been identified and recognized by the government as one of the high impact interventions with high return in investment. As you can see with the ambitious scenario, we can have $10 return for every $1 invested in Sierra Leone on family planning. And the final slide, please. Finally, as UNFPA, as my colleagues might have also touched upon, provides almost more than 90% of the family planning supplies need for the public sector. In the last 5 years, UNFPA has spent around 13.8 million USD on contraceptive supplies, and another 1.8 million for health system strengthening, more inclined to supply chain system strengthening. And very interestingly, we have also signed the compact agreement on having gradual increase of domestic financing to reproductive health supplies with the Ministry of Health and also Ministry of Finance, even though we are yet to see the disbursement and execution of that budget. And in terms of health system strengthening, these are the areas that UNFPA is investing on to expand method mix and choice, strengthening supply chain management, strengthening health financing, and also on data generation and evidence use for programming. Thank you so much, Farhan and colleagues. Over.
Thank you so much for that, Gamachis. Very quickly moving on to Baindu from the Jepaigo team. Baindu?
Good morning, good afternoon. Can everyone hear me?
Yes, we hear you, yes.
Good. My name is Baindu Kusea. I am from Jepaigo, but today's presentation, I'll be presenting on behalf of the USAID MOMEMTUM Country and Global Leadership Consortium. And two members of the consortium are local partners that we work with on this called Health Alert and Sierra Leone Midwives Association. So they have made my work a lot easier. They will make my work a lot easier moving forward. And so in Sierra Leone, the US MOMEMTUM and Country and Global Leadership project really aims to provide technical and organizational support to the Ministry of Health and local partners to improve the demand and quality and uptake of RMNCH and family planning services in country. This consortium is led by Jepaigo with other implementing partners, including Save the Children. I won't go into this background data that looks at all because Gamachis and other partners have already presented it. But what I want to share is that in Sierra Leone, the maternal mortality reduction is high on the Ministry of Health agenda. And as such, it has been declared a public health emergency. Data in country has shown that more than 1/3 of maternal deaths occur among adolescents and youth, and that 40% of all deaths among girls aged 10 to 19 are related to maternal causes and complications even such as unsafe abortion, which is why it's a priority for family planning. Family planning is a priority for as a major strategy for maternal mortality reduction, really focusing on adolescents and youth. It is with this backdrop that USAID MOMEMTUM project in country has partnered with several local organizations to improve the uptake of quality family planning services. Next slide, please. Whilst we don't engage conventional private sectors, I would like to highlight the work we have done with these three local organizations. And I think CHASU, that is the Christian Health Association of Sierra Leone, can serve as a private sector because they are not government. They're faith-based facilities that work very closely with the government. In Sierra Leone, CHASU facilities get some form of government support, a little bit in terms of commodities, but they are really private sector. So to support family planning service uptake and quality, we are working with Sierra Leone Midwives Association, and with that, Jepaigo as a primarily provides technical and capacity support to the Sierra Leone Midwives Association, and through them, we've been able to roll out health workforce capacity building using the low-dose, high-frequency approach, which ensures that the number of health service providers that are trained to provide large services is increased. This approach, we go down to the facility and health workers, as much as 5 to 6 health workers at a facility are trained, rather than removing them from the facility to a district where most times it's one person out of the facility trained and they're away from the facility for 3 to 5 days. And one thing we've also done is incorporate clinical mentorship, integrate that with quality improvement. So USA Momentum has really built the capacity of Tourism Association, and they are leading this work in country. And someone mentioned WCA, we also roll that as well, the CPD platform that they do. And as a whole, we have increased the number of trained staff that provide LAC services in country. And however, certain cadre of health workers, the MCH8s, have not benefited from this. And in lower facilities, such as the peripheral health units where MCH8s are, the law in country prohibits us training MCH8. So this is a huge gap in country that we've not been able to, and it's a policy-related gap. We also work with another organization, Focus 1000, and they really lead the demand creation bit, and they work with various community structures ranging from religious leaders, traditional healers, and through this project, they've done research to identify barriers, they develop SDC messages, posters, they do media engagement, and also work with school health clubs at facilities who are linked to the to school health clubs in surrounding supported facilities we work with, and ensure that health promotion is done in there. And these school clubs, these students are directed to the closest facility. Health Alert, you just heard their presentation. We really worked with them for improved smart advocacy, for increased funding at national and district level, and really youth involvement, like Dalton already mentioned, actively working with them. And one key area MCGL has been able to support is the National Youth and Adolescent Family Planning Conference, which I will end my presentation on, because it's one innovative way we have pushed forward to increase service and demand among adolescents and youth. With Christian Health Association of Sierra Leone, through the USA Momentum work, we have worked with up to 15 faith-based facilities. Traditionally, these facilities don't provide long-acting reversible contraceptive methods. So through our work with CHASL, we've been able to engage religious leaders to advocate for family planning service provision. And we've been able to train the health workers at this facility to provide these services. And those facilities where it's still an issue, because some facilities have been difficult to take on this, it's a gradual process. We have introduced fertility awareness methods at these facilities and work with them to cancel any refer to the nearest facility that can provide this service. As a whole, in the last 3 years since US Momentum has been operational in Sierra Leone, we have supported 3 facilities cutting across 6 districts in Sierra Leone. Some of these districts we have rolled out we started in the first 2 years, and in this last year, we are working in 3 districts. The first 2 years, we're working in 4 districts, but a total of 83 facilities have been worked with. Next slide, please. In addition to the work the local partners do, the consortium as a whole, like I said, led by JPIGO, Save the Children Ibarra, JPIGO in collaboration with Save the Children Ibarra, have been able to do a lot of FP-related work at national, district, and facility level. At national level, we have supported the standardization of family planning training curriculum that can be used across, whether it's faith-based, whether it's government facilities or any other facilities that need these curriculums. We have also supported the development of standardized family planning clinical mentorship guide that's now used by the Ministry of Health. And we supported the development of a family planning capacity implementation plan. Like I just mentioned, the previous one has expired. There's one that will be rolled out in October. It's the new capacity implementation plan. And right now in progress, we'll be supporting the development of training database. We acknowledge that a lot of health workforce capacity building goals, and it's done in country, but there's no consolidated area to know what health workers have been trained, what commodities they have been trained in. And so making sure that resources in country are pooled, and we know this database is currently in development. And lastly, the importance of use of data for decision making, and this really will pull in data from all across any facility that reports into the district health management team, doing private sector, be it faith-based, be it government. This FP Data Pro dashboard pulls in data from the DHIS2 and makes it accessible. It visualizes the data for decision makers at national level, at district level, to use data to inform decision-making, implementation, and quality improvement. At district level, we have really supported what we call FP Data Clinics, which is basically supporting the district health management team to sit together, review the district data, identify poor family facilities that are performing poorly when it comes to FP service delivery, and really investigate what the root causes and develop action plans to address those. Similarly, whilst MCGL only supports limited districts, we also have something.
Baindu, if we can summarize, please. Sorry.
Yeah, so the district learning experience, bringing in various districts to share what has worked. We have FP quality improvement work that's led by district. And at facility, each facility have family planning QI projects to really investigate user data to implement QI activities. And the project has also supported M-Supply, which is digitalizing the RRB forms so that supply chain, we know where stockouts is happening. And we have supported distribution of FP kits at facility level, like UNFPA mentioned. FP commodities are largely supported by UNFPA, but the kits we have been able to. And there's also client exit interviews for adolescents for FP services, which has also informed service quality of service. Next slide, please. So one of the big innovations we've used is this youth-led innovation, where in our annual adolescent and youth family planning conference, we bring youth from all across the country, ask them for innovative ways to increase the FP uptake. And in the last 2 years, we had a winner that really proposed working with youth to have a tricycle that can deliver FP information and service delivery to schools, to community gatherings and teenagers. This innovation has been rolled out nationally and district level, supported by USA MOMEMTUM. The Minister of Health launched this at national level. They are recognized at district level, and shout out to Health Alert, really working with these youth and with MCGL support to make this possible. Next slide, my last slide now.
Baindu, if I can, I think I'll have to, just in the interest of time, I'm so sorry, but I think we can leave it on as we are calling the other presenter so people can just go through it really quickly.
So I think a key thing we want to do is link this FP Youth Connect innovation to service provider, because right now there are links to the district health management team that provides them commodities when they go out. So this is the key next step for us moving forward, as well as these standards and for improving family planning. That's my presentation. Thank you very much.
Thank you so much, Baindu. Edward, very quickly moving on to Edward from Marie Stopes.
Marie Stopes is a leading sexual reproductive health family planning organization. We are a non-governmental organization. We've been in Sierra Leone from 1986. And we are a household name in Sierra Leone, and we ensure that we reach the most disadvantaged and marginalized youth in the remote and last mile areas for SRH access. Next slide, please. Next slide, because that's just to show you where our outreach is at. In terms of our 2030 reach, we can move on to that. Let's go to the next slide, please.
This
because
one?
of time. Yeah, no, the next one, that one, yes.
Okay.
Next,
yes.
after this, the one with the map.
Okay.
Great. So this basically is telling us that for Marie Stopes, our reach in Sierra Leone is in all districts. We have 14 outreach teams, 13 in the regions, and we have scheduled outreach to slum environments within the urban settings in Western area and most of the regional headquarter towns. For public service support, we're actually working with 131 government sites and 7 static centers where we provide full choice for family planning and on non-core services, which is like general medicine. We do have a contact center, which actually is very popular, 3535, that supports a continuum of care for our clients across the whole country, knowing the limitations with networks and connections. We do have a social marketing component that not many people are aware of, but definitely we are getting there. We have a network of about 700 pharmacies and drugstores we reach with clients through the private sector. Next slide, please. So I will give you as I go the specifics on the details. Our outreach clinics works for 5 days in a week, from Monday to Friday, but sometimes their work schedules shift because they need to reach out to weekly markets who sometimes are organized within the weekends, and they can take a day off from that week because they are attending services, meeting clients within the weekend on Saturdays for big weekend, weekly market days where they can reach out to a lot of women who otherwise could not have access because of their locations and restrictions within their communities. Next slide, please. Right, in terms of health system strengthening, as I said, we are working across the district, working with 131 government facilities. We have the largest spread in terms of marriage for Sierra Leone, in terms of family planning and other issues. We have trained service providers who do mentor them and give them internal and external quality assurance data, which is one of our core in terms of getting things done. And services are regularly, we do all of the services that we do, implant and all of that, post-abortion and all of that. Next slide, please. And part of the strategy is we leave no one behind. And currently we are looking at our adolescent reach in Marie Stopes is very key. We are at 42% in 2022. And in 2023, we are at 36%. We had a drop. I was not able to put it in this slide. But it's very key that outreach is a very good method of reaching out to young people outside the capitals where you have high numbers of uptake for family planning. But it's really interesting that we contain and maintain that support to the rural communities and how to reach communities. Next slide, please. Our statics clinics is, these are the centers we have trying to address issues, general services, and we are in different locations. Yusuf, I'm not seeing your slide. We're in different locations in the district. But what is interesting about this, we have our local partnership. Our system, our health systems, the quality of service that we provide has given us a niche within the insurance platform, wherein we actually are organizations serving corporate organizations like MSF, France, Sierra Leone Company, Oral Insurance Company, ReedCorp, C-Coach, and some of the corporate banks in Freetown. Next slide, please. Yeah, this is our social marketing platform. Basically, it's just an introduction, but we are well ahead of this. Marie Stopes is we have a business component of Marie Stopes which sells products to hospitals, pharmacies, drugstores, and supermarkets. Currently, we are in engagement with quite a number of the different institutions trying to establish a referral mechanism where our products will be established in all of those things. And we are also not only just selling, we're actually providing training into hospitals, midwives, and doctors, and actually building in a very strong demand generation activity that we access all over Sierra Leone. Next slide, please. These are just key interventions that we do. We engage with youth, community engagement. We work with people with disabilities. We change the social norms. And that's a very key thing. Our Safe Model Reproductive Health, the bill. Marie Stopes is a key member in the technical working group, and we have seen the progress we have made, and we expect that there will be a big bang before the end of the year. Thank you. Next slide, please. We cannot do this without the clinical quality standards, which is very rigorous in terms of Marie Stopes. We are well known for our standards and the comprehensive training and quality checks that we do have. We do competency assessment. We do joint supporting supervision with the ministry officials, and our internal audits and external audits actually qualify and rates clinical standards across all our programs, including the public sector, where we are actually just supporting for sustainability. So the clinical support goes with on the job training, and we do a lot of online technical trainings, clinical record audits, incident reporting, and we conduct monthly meetings using audiovisual systems and online platforms. Next slide, please. So our clinical quality outcomes is like this. We put input in policies, guidelines, personnel. We process it through clinical governance incident, clinical quality reports, provider competency, product quality, and the outcomes is what we want to achieve and help the public sector and other service providers is to give them high quality clinical services, safeguard clients' well-being, exceed client expectation, and minimize organizational risk. Next slide, please. Next. This is our impact. It's just for you to have and to get in touch. That's our impact. Definitely is impact data is online, and this is how you get in touch with you. But one thing I want to establish before this is my last slide. It says Marie Stopes is a household name in Sierra Leone, and our establishment, our reach is far beyond what we can do, and there is so much need in the country that we need to make sure we continue to engage and support the rural community, especially with our outreach and all of the channels that we're operating. I want to thank you all. Those are our contact numbers. We support continuum of care for all clients. Thank you.
Thank you so much, Edward, and what a good note to end on. Firstly, apologies to the participants. We've gone slightly over time, and I think we've been unable to present other presentations. We'll get in touch with those presenters.
I just want to express my thanks on behalf of USAID, including Sierra Leone, and perhaps Aya can make comments on the next follow-on session. Yeah, so again, just a big thanks. I think this shows how much is going on in Sierra Leone. And I know for me personally, there are things that I'm quite interested to hear more about. And I know that Megan Christofeld had suggested that a follow-on discussion related to challenges in market development and engaging the private sector could be quite valuable. So perhaps we can consider something like that in the follow-on. Thanks again.
Yes, I think we definitely should. Thank you. Thank you, Andrea. Thank you, everyone. And yeah, we'll be in touch and let you know of the next session. Thank you so much for those who stayed on longer beyond time.